Good morning. In the previous video, we saw the digestion of lipids. Now we will see how exactly the absorption of these digested products will happen. So Bergstrom is the one who gave the theory for absorption and transport of lipids. So according to him, it's a passive diffusion mechanism. So the steps involved are: first there is formation of micellar structure, mixed micelle are formed, then they will be absorbed into the mucosal cells where there is reesterification of these digested products. Then they form chylomicrons, and these are the ones, the chylomicrons are the ones which are transported into lymphatics. So we have to remember it's the lymphatics. From there they enter the circulation and peripheral tissues where they are used or stored. So we have seen in the steps of lipid absorption, mixed micelle formation is the first step. So micellar structure is a spiral or a disc structure which is formed at the microvillus surface of the jejunum mucosa, and they are amphipathic in nature, which will enable easy transport. They are made up of an outer layer which is hydrophilic and an inner core which is hydrophobic. So the hydrophilic, the outer layer, is mainly by an amphipathic lipid, that is phospholipid. So this micellar structure is a assembly of phospholipid, 2 MAG, long chain fatty acids, cholesterol, bile acids. As we know that fatty acids which are short chain, medium chain and glycerol, they directly enter portal circulation. They do not require any specialized structural formation. So the micellar structure, which is an amphipathic structure with the hydrophilic outer coating and a hydrophobic inner core. So they assemble themselves over this microvilli. So this is the microvilli of the intestine, small intestine. So they assemble themselves here, and once they align at the microvillus of jejunal mucosa, they are transported or absorbed into the mucosal cells. Now we will see, once they are absorbed into the intestinal mucosal cells, how reesterification formation of chylomicron will happen. So assume this as the intestinal lumen, this area as mucosal cell, and that's the lymphatic, and that's the portal vein. So in the lumen, now we have the micellar structure which is formed with the hydrophilic outer coating and hydrophobic inner core. They assemble over the microvillus. So before their absorption into the mucosal cell, bile acids are removed, and the contents like the digested products like 2 MAG, long chain fatty acids, cholesterol, isophospholipids, they are absorbed into the mucosal cell. Short chain fatty acids, medium chain fatty acids, glycerol, they don't form the micelle, they directly enter the lumen and they will be moving on to the portal vein directly. So this movement is a passive diffusion mechanism. So glycerol will enter the portal vein, the portal circulation, and from portal circulation enters liver. Now we will see one by one how these digested particles in the mucosal cells are re-esterified. So the long chain fatty acids are activated to acyl-CoA with the help of coenzyme A, and we require thiokinase, which is an ATP dependent enzyme. So before this re-esterification, the fatty acid should be activated. This Acyl-CoA now can, three molecules of it can esterify with the glycerol to form triacyl glycerol, or that can esterify with 2 Mag where it is transferred onto 2 Mag to form diacylglycerol. Again, one more molecule of acyl-CoA is transferred onto it. There is re-esterification which will form triacylglycerol. So, two acyl-CoA molecules are transferred to 2 Mag to form TAG, that is triacylglycerol. So, this is one way TAG is formed. Same acyl-CoA, that is the activated fatty acid, can bind to cholesterol to form cholesterol ester, or it can bind to lysophospholipid to form phospholipid. So all the enzymes, if you observe, there are transferases. So they transfer this activated fatty acid onto either 2-MAG or cholesterol or lysophospholipid, forming triacylglycerol, cholesterol esterase, phospholipid accordingly or respectively. At the end of this re-esterification mechanism, in the mucosal cell we have triacylglycerol, cholesterol ester and phospholipids. So along with these three, few apoproteins and fat soluble vitamins like A, D, E, K, they all combine and they assemble themselves into one more structure, that is a lipoprotein called as chylomicron. So all these will assemble themselves to form a lipoprotein chylomicron. Chylomicron is the way by which the triacylglycerol and other lipids along with fat soluble vitamins are transported. So these chylomicrons will enter the lymphatics. So they don't directly enter the circulation, they enter the lymphatics. From lymphatics through thoracic duct, they enter the circulation and they are either used or stored in the peripheral tissues. So these are the steps of digestion, re-esterification and formation of chylomicrons. So once again, I will be summarizing the micellar formation after release of bile acids. The all other contents will, through passive diffusion, enter the mucosal cells, and short chain fatty acids, glycerol, they directly enter the portal circulation and enter liver. There is activation of fatty acids with the help of thiokinase enzyme and coenzyme A, which is ATP dependent reaction. And this activated acyl-CoA can esterify with 2-MAG cholesterol or lysophospholipid to form TAG, cholesterol ester, phospholipid respectively. All these re-esterified products along with apoproteins and fat soluble vitamin, they assemble and form chylomicrons, and these chylomicron enter the lymphatics, that is thoracic duct, through thoracic duct enter circulation and utilized or stored in peripheral tissue. Now we will see what is the role of these bile acids or salts in the digestion and absorption of lipids. So these bile acids or salts are synthesized in the liver. They are derived from cholesterol. The primary bile acids are cholic acid and chenodeoxycholic acid. So they are stored as a conjugated product of glycine and taurine, and usually they exist in the salt formation of sodium and potassium. That's why they are called as salts of sodium and potassium, glycocholate or taurocholates. The secondary bile salts or acids are deoxycholic and lithocholic acids. These bile acids help in emulsification process where tiny smaller lipid droplets are formed, where there is reduced surface tension. They provide larger surface area for the enzymatic action. So this part is in digestion of lipids. And also they help in formation of micellar structure. They help in packing of digested products and transport of these lipids towards brush border of small intestine for absorption. Other requirements for digestion are the hormones. The important hormones are gastrin. It will stimulate the secretion of gastric lipase. Cholecystokinin and pancreozymin, CCK-PZ. It helps in contraction of gallbladder and empty bile into the common bile duct so that bile acids enter the small intestine and help in digestion and absorption of lipids. Secretin and hepatocrinin also stimulate the discharge of bile. Here, a proteolytic enzyme trypsin plays an important role where this enzyme activates colipase so that if we can recollect, colipase is a very much requirement for the complete activity of pancreatic lipase enzyme. Applied aspects or clinical aspects of this fat or lipid digestion is steatorrhea. Steatorrhea means fatty stool. The normal excretion of fats is less than 6 grams per day. If it is more, we call it as steatorrhea. This steatorrhea can be due to defective digestion or defective absorption. When digestion itself is defective, there is no splitting of fat. That's why if there is defect of digestion, unsplit fat is excreted. So for example, in cases of chronic diseases of pancreas, pancreatitis, cystic fibrosis, tumors of pancreas, where we don't have pancreatic juice and in turn the enzymes required for digestion, there is no splitting of fat, and that's why in these conditions unsplit fat is excreted. On contrary, we have it can be due to defect in absorption mechanism where the digestion has happened but there is a defect in absorption. So in this condition there is splitting of fat but it is not absorbed. So whenever we have split fat in the stool, it says that digestion is there but there is a defective absorption. The causes can be obstruction of bile duct, gallstones. It can be celiac diseases, Crohn's disease, or surgical removal of intestine where the major absorption surface is present. So the diagnosis can be made with a history where the patient may say that there is excretion of greasy stools, foul smelling stools. Microscopic with Sudan stain of stool will show the either split or unsplit fat, and we can also assess steatocrit. Coming to treatment aspects, intake of dietary lipids with short chain and medium chain are advised in pancreatic diseases or whenever there is a malabsorption or steatorrhea, because if you remember the digestion and absorption, the mechanism for these short chain medium chain THGs are very simple. They don't require extra mechanisms for the digestion and absorption. A simple lingual lipase and gastric lipase is sufficient for their digestion, and micellar formation is not required for their absorption. Other applied aspects are chyluria. It's the abnormal connection between urinary tract and lymphatic drainage where the lymphatics will enter the bladder, and that's why there will be excretion of milky urine. Chylothorax, it's an abnormal connection between the lymphatics and thorax. Gallstones, again, if cholesterol is more, then they can form gallstones. So we started with a case where a 36-year-old male, he suffered from steatorrhea and pancreatic disease. Now I think by this two short videos of digestion and absorption, we are able to answer what is steatorrhea, why steatorrhea is seen in pancreatic diseases or acute pancreatitis, what are the enzymes and hormones involved in digestion and absorption of lipids, the role of bile acids as salts in digestion and absorption, and also what is the dietary modification which should be advised for a person suffering from either malabsorption or pancreatic diseases. Thank you.